With hypothyroidism, we think about its impact on the autonomic nervous system. And when I think about hypothyroidism, I think of everything slowing down and things not contracting, being a little bit more delayed. So when we're thinking about hypothyroidism, it can contribute to the smooth muscle and those neuromuscular slowing of the pelvic floor and even of that detrusor muscle. So you're going to see delayed bladder emptying, maybe some hesitancy, disruption in that pelvic floor coordination because that signaling isn't getting there fast enough for you to be able to coordinate those muscle contractility. And even then, if there's a little bit of overflow, then you can have a little bit of incontinence and leakage that goes there too. The other thing to think about is constipation, because everything, again, like I said, is slowing down. So the gut can slow down too. And when you have constipation and fullness of the rectum, that's going to put extra pressure on the pelvis and the bladder that can make it more difficult for people to empty out their bladder as well. With hypothyroidism, again, we think about things slowing. So metabolism can slow down too, and we may see more body composition changes, so increased adipose tissue in the central part. And we know that central adiposity can increase that intra-abdominal pressure and putting pressure on the pelvic floor and the bladder, and that could worsen those urinary symptoms. Because we haven't really been taught how much the endocrine system, especially thyroid, affects the pelvic organs. And it is really easy to say, oh, somebody's been pregnant or somebody's had a vaginal delivery. Really easy to just blame those things and just go, okay, it's just kind of normal. This is just what you have to deal with, rather than really investigating further and going, this doesn't sound right. And even though this may be something common, it doesn't necessarily mean that this is a normal thing that we should actually just let go by the wayside. And so, especially too, as we see some other endocrine function changes with menopause and perimenopause changes, we are giving out localized hormone estrogen cream, and maybe that gets things a little bit better. And I also think that women have been taught to just be happy with any improvement rather than going, well, how far can we go? So this estrogen cream is getting me 50% better, but if we improved my thyroid or we looked at some other things, maybe I could get 80% better. So I think it's also socioculturally what we have been, those messages that we have been given, unfortunately. And until things change too, from a medical training perspective, from a provider standpoint, we're not even going to be able to help and advocate for our patients to make those changes.